Welcome to this week's Point Counterpoint. I am Dr. Amelia Barrett. I'm a neurologist and headache specialist, and I am with Dr. Tanya Walker-Painter today, who is a naturopath. I have been getting a lot of comments in my Facebook group from people thinking that they may need to go. So we wanted to put our heads together today and offer you our best tips on how to manage that experience that happens for so many of us. One of my people said, I've had this migraine since August 2nd that doesn't go away. It eases up when I take my cocktail at home or go to the ER. I've been 5 or 6 times this month. I've changed PCP, wonderful working on changing medications around. And that is what really got me thinking, I think it would be of use to people to understand a little bit about the emergency room, what to expect, how to navigate your experience, and how to make the most of it. I want to start with this. Dr. Painter, can you give us a little bit of an idea of what you advise your patients in terms of how to advocate for yourself when you're in the emergency room? Do you have some kind of standard tips and tricks that you give people?
Yeah, Dr. Barrett. So, I mean, listening to those statistics, it's really not surprising because I remember back in med school, we got maybe an hour and a half out of all of the hours of neurology was focused around migraine and headaches. And that's it, hour and a half. And that included cluster headaches and vestibular migraines and regular migraine and, like all of the headaches that could possibly be, tension and, all of it. So it's unless you're actually diving deep into it, not a lot of doctors are trained in how to properly diagnose. And so one of the things that I like to educate my patients around is actually having a copy of the diagnostic criteria for migraine. And when you know that you're going in for a migraine, you hand it to the doctor, to the attending physician, and you say, here is the diagnostic criteria for migraine. Here are my symptoms. Please treat me appropriately. And so that way, they have it right there. It's top of mind for them because, ER docs, they see all kinds of things, right? And so they're going to be, really concerned about moving you through as quickly as possible. And they might not even have the consideration of migraine. They might be thinking something else, or maybe they're thinking that you're drug seeking for something, depending on what you're asking for, which is a very top of mind thing for a lot of ER physicians. And so having that diagnostic criteria and showing them that, you actually have put thought into this. This is not a drug seeking thing. You've been in the ER for this before. Here's what they've done. And that can be really helpful in going to, I don't want to say legitimize your reason for being there, but I mean, in all honesty, that's kind of what it is in some cases, because if you're showing that you have this history and you're showing them that you know what you're talking about as regards to your symptoms, that can be really helpful in the doctor's mind to think, oh, wow, this person is not just drug seeking, because they're not going to be asking for a triptan if they're, on top of the pain meds that they're asking for too, right? And so I like to just have that as kind of you can just print it out, carry it with you in your wallet or your purse, just another thing to add to your go bag. But then the other thing that I really like to have my clients do is building a list of what works and doesn't work for you. Most everybody who's had a migraine at some point in their life have probably been to the ER, have had some sort of an acute visit with their doctor, something that worked to help abort their migraine. And so if you can start building a list of what they gave you and what works and what they gave you and what didn't work, you can start to piece together what you specifically need when you go into the migraine or into the ER. And that's not to say that the doctor is going to take that and give you everything on that list, but it will certainly help them to think maybe outside of the box they would normally think. Maybe they'll go to some meds that they wouldn't normally go to if they know that you've tried this 14 times and it's worked 13 out of 14 times. So that can be a really helpful tool for the ER doc, especially when they're really busy and harried and they have a bunch of other patients that they're trying to deal with. It can just take some of that brain load off of them. So that can be really helpful. And then also just having a pre-typed list of the current medications that you are on, and you keep it up to date. So you can hand it to them and you can let them know, what it's for. And that way a lot of times when you're in that much pain, you're in the ER, they might not have time to go through the full list, and you might not be able to remember everything that you're on or why you're on it. And so if you have that information available, again, they can look through it and say, oh, they're on, this, that, and the other thing, and this helps, this doesn't help, whatever. That really helps to take a lot of that decision-making process away from them so that they're really focused in on the best treatment for you and not just what their kind of standard box diagnosis migraine medication treatment is, right? And so those are the things that I really like to, and then being okay to stand up for yourself and saying, what are you giving me? I want to know what you're giving me. And if you don't like what they're giving you, tell them, I don't want that. That doesn't work for me. This does. And just be firm, because, a lot of times people don't want to argue with the doctor, but it's your body and you should have some say in what's going into it. And it's okay for you to stand up for yourself. And of course, they have the ultimate decision. They're the deciders, but any good doctor is going to take into account what their patient is telling them that they know that works for them. So it's okay to tell them that and let them know, hey, this is what I really think can be helpful for me in this situation. It's worked before. And, and just have that conversation with them instead of just allowing them to do whatever.
And I love, love, love what you said about keeping a list of things that have worked for you and things that have not worked for you. And I would encourage all of you to try asking the doctor for magnesium. We've had some discussions about this recently, and I interviewed Dr. Alexander Mouskop, who is one of the original investigators in the use of magnesium for migraine. And his recommendation was to give the magnesium as fast as possible. He pointed out that it's the peak dose of the magnesium that really makes the effect and makes the headache go away. And we know from other studies that IV magnesium alone can take away headaches 86% of the time. But most people will give it slowly in the emergency room. So definitely put magnesium, whatever they have on hospital formulary, 1,000 milligrams by IV, and tell them to just give it by IV push, to give it you quickly instead of letting it drip in over a couple of hours. I would definitely add that to the list of things you want to try next time you go in. When headaches get bad, there usually are a couple of different biochemical pathways going on. Inflammation can be part of the picture, so anti-inflammatories help. Magnesium really helps to settle down some of the overfiring and hypersensitivity that happens when headaches won't go away and stay away. So they work by different mechanisms. And so those are good ones to ask for in combination. And just to say, this is a video, I'm not your doctor. Make sure you review all of this with the person who's actually there treating you, looking at your medical list, looking at your past medical history, and making sure that these are appropriate recommendations for you. But another topic I wanted to talk about a little bit is typically when people are in this situation where headaches are just not going away normally, the brain is actually starting to change the way it fires, the way it's wired as a result of the headaches. This is a process called chronification, and I think there's not a lot of awareness out there about that. So I created a quiz to help people understand if this process is affecting their brain or not. You can take that quiz at theheadachequiz.com, all one word. And it'll tell you what your headache severity score is and give you recommendations for treating your headaches based on your headache severity score. And that revolves around whether or not your brain is starting to show those chronic changes, because treating headaches is very different in somebody who gets headaches once a month versus every day. Wouldn't you agree, Dr. Painter?
I would. Yep, for sure.
Yeah. Whole different brain you're dealing with there. And sometimes the same recommendations don't apply.
Yep.
All right. So, Dr. Painter, if people want to get more information about working with you, can you give us your website?
Yes, ma'am. Migrainemastery.org. And we have a few free resources available. There's some free videos and trainings and things that we've put on over the years as well. So certainly any of those things can be helpful. Really digging into the reasons behind the migraines in particular, as opposed to just treatment for treatment's sake, right? We want to know what's imbalanced and how can we get that back into a place of healing so that the migraines are no longer the dominant factor in life, right? You can actually go out and enjoy yourself again. So
yeah, I think that's the goal for all of us, right? We may not be able to change the fact that we still get a migraine from time to time, but if we can make it last an hour and get back to our lives,
yep,
that's the goal.
That is the goal. Absolutely.
All right. Okay. Thank you so much for joining me today. Dr. Painter, and thank you for everybody for being here. Hope that helps. All right, take care now. Bye.